I'm Eric Parker. Tonight on a special Monday evening edition of CT21. More than 700,000 dead in the United States in a pandemic that caught our country and the world off guard. 8,600 of those deaths occurring right here in Connecticut. A number of the 43 million diagnosed with the coronavirus who survived will never be the same. Vaccines are here and have changed the trajectory of the disease, but not enough people are getting them to eradicate it. Dr. Scott Gottlieb, the former FDA commissioner and Face the Nation contributor, is joining us this evening to talk about what did we know and when did we know it and what mistakes were made along the way. Governor Lamont is also part of our conversation this evening. We'll be looking at how our state had to step up when the federal government let us down, and we'll get into the much debated topic of vaccine mandates. It's all ahead this Monday evening, October 11th. A special edition of CT21 starts right now.
Now, a CT21 special, Coronavirus in Connecticut, sponsored by Hartford Healthcare.
Good evening, and thank you for being with us. I'm Eric Parker. Welcome to this special one-hour Monday night edition of CT21. Tonight, it's the governor and Dr. Gottlieb. They're doing a deep dive into the pandemic, from when we first learned we had a problem, to developing testing and vaccines, to how this will all likely end. We're looking at the successes and the missteps along the way. Much of this is included in Dr. Gottlieb's new book, Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. Dr. Gottlieb is joining us this morning, the former head of the FDA. He's a Wesleyan grad, a Westport resident. You can see him many Sundays on Face the Nation. He's joining us from his home studio. Thank you for being with us, Dr. Gottlieb. Right here to my left is the governor, Governor Ned Lamont, joining us as well. Dr. Gottlieb, I want to start with you. I've read your book. It's fabulous. It's probably the most endnotes I've ever seen in a book, but I suspect you started by saying you wanted this to be a non-political book, and you cited multiple facts as you went through there. Was that part of your goal, to say, I just want to lay out what I know and not get caught up in the politics?
Well, look, I wanted to get beyond the political narrative of who did what when and try to get at some of the core issues that I think plagued us and left us excessively vulnerable to this pandemic. There were systemic features of government, things that we didn't have in place at the federal level that we thought we did, particularly at the CDC, but also the past pandemic planning, that I think left this country vulnerable to this pandemic. And if we're going to plan better for the future, we're going to have to learn some of those lessons and shore up some of those weaknesses.
And one of the big themes early on in the book, Doctor, is that this is not the flu. And much of our planning was aimed at the flu. And was that one of the things that hamstrung the CDC and the federal government early on, is that for years everything had been flu?
That's part of the problem. I think the other part of the problem is that CDC, which really had the ball, we put CDC in charge of leading the response to this pandemic, really doesn't have the logistical capacity to lead that kind of response. They don't have the capacity to manufacture and deploy massive amounts of testing. They didn't have the capacity to deploy vaccination sites. They really didn't have the capacity to collect information and do real-time analytical work and issue guidance to inform current policymaking. You know, CDC is a deeply retrospective, high science organization that's accustomed to collecting data, doing very careful analyses. They're accustomed to being the definitive word on a question, not the first word on a question. And in a crisis, you need that kind of real-time information to inform policymakers who have to make decisions in the moment. You need almost like a joint special operations command for a public health crisis. And CDC functions a lot like a public health institution that just does very careful work but takes a lot of time. And that left us without the kind of recommendations and guidance that we needed to inform decisions that had to be made by policymakers like the governor and others.
And I think one thing that becomes clear as you read the book is certainly that there's not a lot of pivot involved in the CDC. They're not calling audibles over there. They have their systems and they work through them one at a time. Was that your experience as FDA commissioner, is that there's not a lot of flexibility there?
That's right. I mean, CDC is a very careful organization and doesn't like to step out too far in front of their analyses. You know, one experience I had was during the 2017-2018 flu season at FDA, when I was running the agency, we were very concerned that it was a particularly bad flu season and that there was a mismatch between the vaccine that had been developed for that season and the virus that was circulating, the strain of flu that was circulating. We wanted to put out a public health advisory warning the public, and the CDC actually stepped in to stop me from doing that in the Secretary's office, arguing that they hadn't reached a definitive conclusion on just how severe the flu season was. We ended up putting out that advisory anyway as an update to the labeling of the vaccines because we regulate the vaccines, so it was our prerogative to update the labeling with some new safety information. CDC didn't formally conclude that that was a particularly bad flu season until the following fall. So it just shows how retrospective they are. They're very careful. They do good scientific work. And it's not an indictment of CDC. We needed to recognize early in this pandemic that CDC needed to be married with other capabilities. And I don't think that that recognition was made early enough by the political leadership. They felt for too long that CDC could lead this response. And CDC ultimately was unable to. And Operation Warp Speed around the vaccines really was a recognition that you needed to create new structures, new features of government in the setting of a crisis like this. So Operation Warp Speed married NIH and FDA with the logistical capacity of the Department of Defense, recognizing that no one agency could lead that effort.
Governor, I want to turn to you. You heard Dr. Gottlieb say that one of the things that CDC had trouble with was advising leaders like you because they are such a retrospective agency. So you and I have talked about this before. March, April 2020, the early days of this pandemic, when the health folks here are realizing this is not just a bad flu. Where were you getting your info? And was the CDC and other government agencies helpful to you?
Not so helpful. Eric, it's good to see you. And Scott, we got to stop a meeting like this. And you're a Connecticut guy. I want a Connecticut backdrop next time. But I went to people like Scott Gottlieb. I found in my job, often you pull the curtain back and you're impressed by what state employees are doing or others doing. When it was the early days of the pandemic, we pulled the curtain back and I was really underwhelmed. The CDC was not taking it seriously. They were slowing down our ability to get test results. Scott writes about that in his book, making us fly blind a little bit. The Surgeon General came up to Connecticut and advised everybody, don't wear masks. They can transmit the disease, counter to everything we had heard from others. So we realized early on that we were sort of on our own on this. So that's why I reached out to Scott Gottlieb. Thank God he's a Connecticut guy and was really taking it seriously, a big help for us. We put together an advisory panel of the best and the brightest. So we tried to recreate what I would have hoped we got from the CDC. It took them a while to get in stride.
Dr. Gottlieb, did you hear that from a lot of different people that you talked to in this whole effort, that there was just conflicting information? It was coming from all different places. One of the things you talked about a lot in the book was that asymptomatic spread, and it was so long before they understood that. Is that just nobody, the target was moving all over the place? Was that the problem?
Yeah, there was frustration with the inability to get really firm guidance and also understand what the scientific basis of the guidance was and which recommendations were more firm than others. If you look at the guidance that CDC issues, they don't really explain the scientific basis for their recommendations, and they don't explain the level of certainty they have. So if you're a policymaker, you can't look at it and say, look, CDC clearly has more certainty around this recommendation than this other recommendation. I, as a policymaker, am going to devote more of my limited resources in trying to get compliance around the things that are more certain and likely to give me more risk reduction. You know, the other big challenge we had early on was the inability to roll out the diagnostic test. And here again, it was left to CDC to develop, design, and manufacture that diagnostic test and deploy it. And even had they not contaminated their own lab and really botched the rollout of that test, we never would have had enough diagnostic testing. We needed to get the private industry engaged in scaling up diagnostic testing at some point in January. That really didn't happen until the end of February. And this was another indication, another instance where policymakers wrongly believed that CDC would be able to lead that effort, and the agency just wasn't equipped to do it. And so, again, it's not really a knock on CDC. I think that there was a failure of political leadership to recognize what the limitations were early enough and engage the private sector and other agencies in trying to accomplish this mission.
And I know that's one thing you said Connecticut did especially well was that public-private partnership. We're going to talk about that a little bit more coming up when this special evening edition of CT 21 comes back right after this quick break. We're back now with Governor Ned Lamont and Dr. Scott Gottlieb talking about COVID and Dr. Gottlieb's book. And Dr. Gottlieb, one of the things that unfolded during the pandemic is that the CDC couldn't handle the testing. You just mentioned that before we went to break. What was the biggest failure as far as testing? I know they were very controlling in how that testing happened, certifying labs. They had their area of responsibility, and they didn't want to give that up, right?
Right. CDC controls access to the viral samples in the setting of a new pathogen like this. And if you're a laboratory, an academic laboratory like Yale, and you want to develop your own diagnostic test, ultimately you need access to the virus in order to develop that diagnostic test. CDC didn't share those samples, didn't start sharing it until the end of February. They also designed the initial test, and they wouldn't share that design either. If a private manufacturer wanted to copy the CDC's test design that the CDC had designed off of their exclusive access to the viral samples, they had to sign these complicated licensing agreements. And I was talking to a lot of manufacturers over that time period. This is January and February, and what they said was it was so complicated to negotiate with CDC that they were going to wait and see. And so really no big commercial manufacturers got in the game, and no clinical laboratories were allowed to go forward with their own tests. So the only game in town was CDC. And so if you wanted to test a patient, you had to send the sample to CDC. CDC had the capacity to test maybe a couple of hundred samples a day. And ultimately, CDC was trying to manufacture its own diagnostic test and deploy it to the public health labs. This is where they ended up contaminating that test. But even had they succeeded in deploying that test to the public health labs, there's 100 public health labs in the country, each capable of doing about 100 tests a day. That would have been about 10,000 tests a day that we could have done back in sort of the February timeframe. We really needed to be doing hundreds of thousands of tests a day if we wanted to identify the early spread and use testing and tracing as a way to contain the spread, to keep places like New York and Connecticut, New Jersey from becoming so heavily seeded like they did in the early days of this pandemic. And so without a diagnostic test, we couldn't do that. We were really flying blind. And equally, not only didn't we know where the virus was, but we didn't know where it wasn't. And so when we eventually had to reach towards population-wide mitigation and shut things down, close schools, close businesses as a way to control the spread because we couldn't identify those cases, we ended up applying those measures across the whole country, even though parts of the country probably didn't have a lot of virus yet, but we just didn't know it.
Governor, you said that was one of your big frustrations, was you could get people tested. And I know we had the mass testing sites at Rentschler Field as things got going. You could get people's noses swabbed. You couldn't get any results.
It took, I think, well over a week to get our 10 results back from the CDC labs down in Atlanta. I think that was a systemic failure. I think the government should have stepped in at the federal level, what we did at the state level, get our partnerships going with the private labs, ramp that up. Testing, as Scott says, we were flying blind too long. You know, if you came from China, you were going to assume your flu was something. It was... we could have been a lot more exact about it. We would have had much better remedies earlier on if we had known what we were confronting.
Now, you were able to get a partnership with a lab here in the state to ramp up that testing. Did that, as the chief executive for Connecticut, change the information you had at your fingertips?
We had Jackson, we had Yale, we had SEMA, we had LabQuest. We worked all over the country doing everything we could to make sure we could do massive testing, localize where the issues were, and take advantage of that. I'd say the federal government did better with public-private partnership when it came to vaccines and Operation Warp Speed. They were Operation Slow Speed when it came to testing.
Dr. Gottlieb, one of the things you talked about in your book was this very issue, in that you mentioned the middle of the country being locked down when they really didn't need it, but nobody knew where this disease was. So did that really cost the feds a lot of credibility?
Look, I think it costs us the ability to target the mitigation. If you go back and look at the 2005 pandemic plan, and I was in the Bush administration in 2005 and working on certain aspects of that, it envisioned using population-wide mitigation as a way to control the spread of a pandemic, things like closing schools, shutting down businesses, but it envisioned that on a very targeted basis. You would only do it in the places where spread was out of control. In many parts of the country during that first wave, we probably had very little spread. There might have been some cities that had very little infection. I don't think Bozeman, Montana had a lot of infection at that point, yet we had to apply the mitigation across the whole country because we just didn't know, because we didn't have something as simple as a diagnostic test to deploy and start testing people. And so what happened was when the pandemic eventually arrived in other parts of the country, like the South, people down there said, look, we've already shut down. You told us to shut down in the spring. We probably didn't have to, and we're not doing it again. And so you lost the political capital you needed in those parts of the country to employ the more invasive techniques as a way to control the pandemic when the pandemic ultimately arrived. Remember, this was a highly regionalized pandemic. The Northeast was really clobbered early on, but other parts of the country weren't similarly affected until much later.
And that's what we see now, is that things seem to be, going better in this part of the country, here in Connecticut, than what we're seeing down in some of the southern states where there is still widespread outbreak, right? So that effect wasn't just a short term. It's still happening today.
Right. There really only has been one point in time when this has been sort of a confluent epidemic across the whole U.S., and that's during last winter. Otherwise, these epidemic waves have been highly regionalized. You saw, obviously, the South get engulfed with the Delta variant. Now the Midwest and the West is seeing big upsurges of infection. I don't think the Northeast is completely out of the woods. I think we could see a pickup in cases, but the high vaccination rates here, especially in Connecticut, where prevalence is low right now, in part owing to those very high vaccination rates, I think they're going to be a backstop, combined with the fact that we've had a lot of prior infections. You know, we were very hard hit by that first wave of infection when we really didn't have any insight into how widespread the virus was because we didn't have a diagnostic test.
All right, we're going to take a quick break here. When we come back, did President Trump grasp how serious the pandemic was? Some of the most telling pages in Dr. Gottlieb's book talk about his conversation, some in the Oval Office with former President Donald Trump. What did Donald Trump tell him about the pandemic at the time? We're going to ask him about that when we come back right after this. We're back now with Governor Ed Lamont, Dr. Scott Gottlieb joining us as well. And Dr. Gottlieb, one of the things I thought was most interesting about your first-person accounts in this book was you had several conversations and some meetings with President Trump. One that you talk about is from March 13th, 2020, very early on. I want to play you a soundbite of the president from that day and then ask you about your meeting. Take a look.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
So that is very early on here, March 13th, 2020, Dr. Gottlieb, the president saying that he was declaring a national emergency. But many of the messages that he delivered to the American public were optimistic, where this will fizzle out in a few weeks. This is something we're on top of. We're controlling it. Don't worry. You say in the book that behind the scenes, he was worried and he did recognize the enormity of what he was facing.
Yeah, look, certainly that day, I got the sense from the president. I had met with him a number of times when I was in the role as FDA commissioner, so I had some sense of, you know, his mood and his perspective on things. Although I wasn't in the Oval Office an awful lot. I had been there, you know, half a dozen, maybe more times. And that day, I certainly got the sense that the president recognized the gravity of what the nation was facing. I had been asked to come down to the White House by some of his advisors to help lay out the case for some of the tough measures that we would need to take, recognizing that this spread was now becoming out of control in certain parts of the country. And when I got into the Oval Office and had a discussion with him, it seemed clear to me that he was already there, that he already recognized that we were going to have to take some hard measures. They announced the state of emergency shortly after that, as you just said, and within really days, they announced the 15 days to slow the spread, the first real national effort towards mitigation, towards shutting some non-essential businesses to try to control the spread.
The one thing that was pretty consistent, though, with the Trump administration, at least early on in this pandemic, was an opposition, for whatever reason, to masking, not just as a policy, but right there in the Oval Office. I mean, the president resisted it for quite a long time before finally the public saw him wearing a mask. Many of the pictures we saw of those press conferences, the people surrounding him, the people behind him didn't have masks. Do you think that that set the effort back to control this?
Yeah, I think it set the effort back insofar as we were unable to get collective action around the simpler things that we could all do on a routine basis to try to control the spread. The masks weren't going to end the pandemic. We weren't going to be able to stop this pandemic in the United States. But could we have slowed the spread? Could we have bought ourselves a little bit more time until we got to a vaccine? Could we have saved some of the lives that we've lost? I think the answer is yes, if we would have had more consistent adherence to a common set of practices that could have reduced the scope of the spread. And you're right, the president could have led on this issue, didn't. He ceremoniously took off his mask while he was still infectious with the virus. I think to your point about the mixed messages, you know, what I saw, that you're right, there were mixed messages early on, but I think it was the fog of viral war. And I think the president of the White House was getting mixed advice, particularly from the CDC, which early on said that there wasn't community transmission when there clearly was community transmission underway. But I think the bigger shortcoming is the lack of consistency through the pandemic. I mean, towards the end, there was a view in the White House that there wasn't much we were going to be able to do to control the spread, and that any actions we took, certainly federally, were just going to risk the economy and not really have an impact on the virus, that uncontrolled spread was inevitable. And I just don't believe that was the case. I don't think uncontrolled spread was inevitable. I think that there are ways we could have gotten better control of this, even if a pandemic was inevitable.
And you actually wrote in the book, I'm convinced if we had adopted a more coordinated national response and stronger surveillance at the outset, we would have had a better outcome. Is that still your view, that it just really was missteps at the beginning that changed the trajectory of this thing?
The missteps at the beginning certainly did. I mean, we didn't need to become so heavily seeded as we did. I think we could have reduced the scope of that first wave of infection in the Northeast, which was devastating. And I think if we had a diagnostic test in place and better surveillance, we could have known that there wasn't virus in many parts of the country and preserved the political capital to implement tougher steps when the virus finally arrived in parts of the South and the West and the Midwest. But we implemented those measures too early up front, the sort of population-wide mitigation, and we lost the leverage to be able to target them when the virus finally arrived in those other parts of the country. This is what South Korea did well, why South Korea got control of their first wave of infection, because they deployed massive amounts of testing, and they did it through public-private partnerships where they engaged their private sector immediately, before the virus even had started to spread in South Korea, to scale up the manufacture of diagnostic tests. It takes about 4 to 6 weeks to get the private manufacturers to be able to mass deploy diagnostic tests, even if they're working at full tilt. And we really didn't start engaging them until probably the end of February, March. That's really when the policy changed, and we made a pivot towards private manufacturers and away from the CDC.
I think you're a little generous when it comes to the White House those early days, Scott. It wasn't just mixed messages. It was really contrary. We're trying to tell people how we take this seriously, how we keep people safe. And a lot of the messages from the White House were it's going to be a bad flu season. Don't worry. Hydroxychloroquine will keep you safe. How about Lysol? We had to tamp all those down. We were trying to keep people from not going into congregate settings. And the president was saying, I'll see you in the big jammed Easter service. We had to speak with one voice, not contrary voices.
What do you think about that?
Look, you know, the governor was in the trenches, and I think it's a fair assessment. There were clearly mixed messages coming out of the White House, and people choose to listen to the messages that were more consistent with their worldview. And there were a lot of people who heard the message that this wasn't going to be bad, that the case fatality rate was flu-like 0.1% and not over 1%, which is what it was in that first wave, much over 1%. So a lot of people who heard those messages and probably didn't adopt the kinds of measures that could have helped control the spread. You know, staying home where they can, wearing masks out, trying to avoid congregate settings that you know are conducive to spread. You know, if we could have just gotten more consistent adherence to trying to reduce high-risk settings where we knew that spread that were conducive to spread, we could have avoided a lot of these super spreading events. These kinds of events were happening in places where you got a lot of people in a confined space with poor air circulation, and we knew what they were. We had a sense of this early on, and we couldn't really get control of those kinds of higher risk settings.
All right, we're going to take another quick break. When we come back, we want to talk about some of those higher risk settings and some of the measures that were implemented. Some of them, Dr. Gottlieb, you say, we were just guessing the best thing to do. We're going to talk about that when we come back. The special edition, the special evening edition of CT 21 continues right after this.
You're watching a CT 21 special, Coronavirus in Connecticut, sponsored by Hartford Healthcare.
Welcome back to this special edition of CT 21. Tonight, we're joined by Governor Ned Lamont and Dr. Scott Gottlieb, the former FDA commissioner and author of Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. We've been talking a little bit before we went to break, Dr. Gottlieb, about some of the measures that were put into place, including that guidance of staying 6 feet apart. And you talk about that in your book. I want to read you a quote that you quoted here. It's from a sociologist, Dr. Zeynep Tufekci in The Atlantic, saying, none of this made any practical sense. What happened at minute 16? Was 5 feet okay? Faux precision isn't more informative. It's misleading. You say in the book the 6 feet guidance that we all heard over and over and over again wasn't really based on science. It was a guess. Is that right?
Yeah, look, this is another example where the CDC really didn't have a firm basis for the recommendations that they were issuing. We did the best we could based on the information we had. That 6-foot recommendation was based on studies involving flu, which spreads predominantly through droplet transmission. We now know that SARS-CoV-2 spreads primarily through aerosols in these so-called super spreading events. So it's not really applicable. A flu-based approach isn't necessarily applicable to the dynamic with SARS-CoV-2, but we did the best we could with the information we had. This 6-foot requirement was the single costliest recommendation that CDC issued. It forced a lot of states to have to close schools because they simply couldn't provide for 6 feet of distance. It also prevented a lot of businesses from being able to open because, once again, they couldn't provide for 6 feet of distance between people. And I think it's an example of where if the CDC had given the underlying scientific basis for their recommendation and been more clear about the level of uncertainty, policymakers could have been in a position to make a decision that 3 feet might be appropriate. The cost of requiring 6 foot of distance, if it's going to force you to have to keep your school shut, you might make an accommodation around that recommendation. Actually, the initial recommendation from CDC to the White House early in the setting of the pandemic was for 10 feet of distance. The White House ultimately told CDC that that was impractical. The compromise was around 6 feet, so CDC went out with that 6 foot of distance requirement. This was ultimately revisited when the Biden administration rightly recognized, when they wanted to open schools in the spring, that the 6 foot requirement was preventing a lot of school districts from being able to open. So they prodded the CDC to reevaluate that. CDC ultimately recommended that as long as kids are wearing masks, they can be 3 feet apart. They based that recommendation on a study that they had done the prior fall, where they demonstrated that if two individuals are standing 3 feet apart, but they both have masks on, you can reduce transmission by as much as 70%, which begs the question, why did they wait until the spring to revise their recommendation based on analysis that they had from the prior fall? So it just shows the arbitrary nature of this. And once again, I think if policymakers had better information about the underlying basis for these different elements of guidance, what the level of certainty was, what the rigor of the science was, they could have made some decisions about which recommendations they were going to follow more strictly and which ones they were going to make certain accommodations around to try to achieve other public priorities like opening the schools.
Well, and you mentioned policymakers. Governor Lamont, you were the policy decision maker on that for Connecticut. And one thing Dr. Gottlieb told us that he felt Connecticut really got right was getting kids back in the school pretty quickly. That was important to you. And how much did that federal guidance play into it?
It really complicated things. And to hear Scott say that 6 feet was sort of arbitrary. And by the way, you have to make a cost benefit of all these different restrictions. When you say 6 feet between desks, you're also saying half our kids can't come into school. And what that means for those kids, what that means in terms of isolation, what that means in terms of mom and dad going back to work. So I think they made a wrong decision in isolation. And as the doctor says, give us a little more flexibility or tell us what the difference is between 2 feet and 4 feet, and we can make some judgments.
All right, we have some questions from viewers, and I know this is something you've heard a lot, Governor. Yeah. Jonathan in Southington wants to know, since COVID is a virus, it'll never go away 100% based on the science. At what point will you unmask our children? Another question came in from Jacqueline in Glastonbury. She wants to know, why are children still mandated to wear masks in school when studies show they're the least likely to be affected by the virus? Dr. Gottlieb, for leaders like the governor here, what do you say about kids and masks in schools? It's a hot topic here in Connecticut.
Yeah, well, look, this Delta variant is a highly contagious variant. It's very effective at finding pockets of vulnerability. And the biggest pocket of vulnerability that we have right now are children who haven't been vaccinated, in many cases haven't been exposed to this virus because we've done a good job sheltering them to date. I think that given this Delta surge is likely to be the last major surge of infection before we enter a more endemic phase with this virus where it becomes a more persistent risk, but we're out of this sort of pandemic phase where you have these major surges of infection. And I do believe that's going to be the case. I think entering this school year, knowing that we want to keep kids safe, we want to avoid outbreaks where you have large infections among kids, and we want to keep schools open. I think the prudent thing to do is to try to go into this year with as much mitigation in place as possible, as many reasonable measures as you can take to try to avoid large outbreaks in the schools and see how it goes. I mean, if we see that we're successful at controlling outbreaks in the schools as this Delta wave courses over the Northeast, you can start to peel away some of these measures. But I don't think you want to go into the school year with one hand tied behind your back, not employing the kinds of things that you know are available that are less invasive, that potentially can keep kids safer in that setting. We saw in the South where they didn't take a lot of these steps. We saw large outbreaks in the schools. We saw a lot of kids getting hospitalized. And in the end, they had to close a lot of schools because of the scope of the outbreaks they have. What you want to avoid here in the Northeast, I think, is large outbreaks in the school that could, number one, cause a lot of kids to get infected, but also force policymakers, force local officials to have to put a lot of kids in quarantine or close schools. We want to keep kids in school and we want to keep them safe.
All right, we are up against our next break, so we're going to talk about vaccine mandates next. More with Dr. Scott Gottlieb and Governor Ned Lamont coming up. Our conversation continues here on this evening edition of CT 21 after this break. Welcome back to this special evening edition of CT21. I want to get into vaccines and vaccine mandates with Dr. Scott Gottlieb in just a moment. But, Governor, I want to pick up just very briefly where we left off in the last segment. Dr. Gottlieb was talking about masks in schools. You have your emergency executive authority through the beginning of next year. You've put an order in place that kids need to wear masks in schools. How long do you expect that to stay in place?
I think the masks in schools was absolutely the right decision last September and this September. Keep our schools safe. As you heard Scott say, you look in southern states where they weren't having masks and hundreds of thousands of kids being forced out on quarantine and their parents could not go back to work. But we are going to have childhood vaccines available within the next month or two. And as they become widely available, we'll have to take a second look at masks in schools.
It certainly is a hot topic here. I'm sure we'll be hearing a lot more about that coming up. Dr. Gottlieb, one of the most interesting things in your book was the talk about developing the vaccine and what an mRNA vaccine actually means. And the old way, you talked earlier in the show about being at the FDA and having to say, you know, listen, we kind of blew it on the flu vaccine this year. Watch out, everybody. mRNA vaccines can happen much faster and can pivot much faster. And that's a huge thing that has been developed as part of this pandemic.
Right, and I serve on the board of Pfizer, so I had some good insight into this process. This was the first time that we employed synthetic tools to try to derive a vaccine construct, and that's why we came up with the vaccine construct so quickly. People talk about the fact that it was very fast, the process for making this vaccine. It was the process for developing the initial construct was very fast because of the technology we were able to deploy to do that. But the actual process for developing the vaccine was very thorough. The clinical trials that we ran for these mRNA vaccines were the largest clinical trials run in modern times. Combined, Moderna and Pfizer enrolled 90,000 patients in that initial clinical trial. The second largest vaccine trial that I remember from my time at FDA over the last decade, really, was the rotavirus vaccine, which enrolled about 70,000 patients. So this was an exhaustive clinical development program, but we were able to pivot very quickly and come up with that initial vaccine construct because of the tools we were able to deploy, these synthetic tools where we use the sequence information rather than having to grow the virus in large quantities in cell cultures, inactivate it, and cleave off its surface proteins and use that as the vaccine medium, like we do for the flu vaccine.
We did ask our viewers for questions, Dr. Gottlieb, and one thing we got from a number of people, and I know you've heard it before, is what you just said in the intro to your answer there. Aha, Gottlieb's on the Pfizer board, so of course he wants us to take vaccines. Have you been hearing that from people, and how do you respond?
Well, look, I certainly want people to seek out the vaccine if it's indicated for them. And I think adults who are indicated for a booster right now, those over the age of 65 and those who live in long-term care facilities, should look into getting boosters as well. I think that there is a lot of benefit to be derived from the booster doses. You know, as a public health official, when I was at FDA, I was very pro-vaccine as well. I put a lot of effort into trying to get vaccination rates up among the population for the flu vaccine. I put a lot of effort in trying to expand uptake of childhood immunizations. And I sought out the roles that I have in the private sector because of my public health interests. And that's why, you know, I wanted to serve on the Pfizer board, because it's a big vaccine manufacturer. It's one of the reasons. It's a big vaccine manufacturer and has a big commitment to this space. We pivoted very early into trying to develop this COVID vaccine and invested enormous resources, a few $1 billion before we had even knew whether the vaccine was going to fully work, to try to get to the point we are here today.
And it certainly has changed the trajectory. Governor Lamont, I want to ask you about vaccines. Connecticut leading the way still for vaccinated population. You have a state mandate for employers, not employers, but state employees, I should say, to take the vaccine. Many private employers are doing the same. Do you think we need to see more of that to get these last few people vaccinated?
Look, I think it's very helpful. You know, as Scott said, we may avoid the worst of what could be a third wave because we're backstopped by having well over 85% of our adult population vaccinated, our kids soon to come. State employees, forward-facing, taking care of people with special needs, disabilities. Yeah, I wanted all of them to get vaccinated. And if they didn't feel comfortable there, then at least you got a test to keep us safe, you safe, and the folks you treat safe.
What do you think about vaccine mandates, Dr. Gottlieb? Is that something that may give that extra little shove to someone who's questioning it?
Well, I think it certainly will, and it's going to help get vaccination rates up higher. I think the federal government is well within their prerogative to mandate vaccination among the federal workforce. That's an issue of federal readiness. I think healthcare workers should be required to get vaccinated. It's an issue of protecting the patients that they care for. We require healthcare workers to get vaccinated for chickenpox, for hepatitis B, for influenza. I don't know that this should be any different. I think when it comes to private businesses, we should leave discretion where we can and try to provide incentives for that, for more private businesses to mandate vaccines. I think a lot of businesses, in order to protect their workforce and protect their customers, are going to have to require vaccination, and it should be their discretion to do that, and I think we should support them and try to provide incentives for engaging in that. That's ultimately going to get more people vaccinated.
Another question we got from a viewer, Dr. Gottlieb. Dan in New Milford asked, will the COVID booster shot be a yearly thing like the flu shot? What does the research say on that? Do we expect this is something we'll have to make an appointment every year?
Yeah, look, it's unclear right now, and it could be that after this third booster, people derive a more durable immunity that lasts a longer period of time. We spaced the first 2 doses of this vaccine closely together because we were trying to get as much immunity into the population as quickly as possible. But by spacing them closely together, it may have reduced the durability of the initial series of the vaccine, and this third dose could provide a much more durable response. So we're going to have to wait and see. I think the likely scenario is that for at least a portion of the population, at least for the foreseeable future, this may well be an annual vaccine until we get this virus under better control and prevalence starts to decline universally. It also could be the case that we end up switching the vaccine to a different backbone. If Delta becomes the dominant variant and future mutations are within that Delta lineage, meaning that, the future variants that start to emerge are Delta, but variations on Delta that partially escape the immunity that we've acquired either through vaccination or natural infection, you could well see a circumstance where we switch the vaccines over to a Delta variant vaccine. Remember, these vaccines are based on the original Wuhan variant, which was really 3 variants ago. We had B117 in the middle, and now we're contending with Delta. So we're lucky that the vaccine still works as well as it does, which shows that a lot of the components of the spike protein, which these vaccines are based on, that surface protein on the virus, are pretty well conserved. But we may end up switching over the vaccines at some point to a Delta backbone vaccine.
Such interesting stuff as we consider where this is going in the future. That's going to be our topic after this quick break. What is next for COVID? What can we expect as we head into the winter and beyond? Are we ready for the next pandemic? We're going to talk about that when this special edition of CT 21 continues right after this. Welcome back now in our final segment with Dr. Scott Gottlieb and Governor Ned Lamont. We're looking to the future. Dr. Gottlieb, one of the things you talk a lot about in your book is that this is something we need to prepare for, the next pandemic. What do you think we should be doing right now, even looking ahead to that there could be something else on the horizon?
Yeah, look, I'm surprised that we really haven't started a robust discussion at the federal level about how we plan for the next pandemic. We will have another pandemic, and it could very well be a flu, a new strain of flu, which is what we've always prepared for. I think we need to look at public health preparedness through a lens of national security. And if you're looking at public health preparedness through that lens, you start to prepare better capacities for dealing with a crisis of this magnitude. So you try to create capacities to scale up the production of antibody drugs, the first line of defense against a new viral pathogen. You try to develop pan-respiratory oral drugs that could defeat a lot of different RNA respiratory viruses, which is really the category of viruses we need to be worried about causing the next pandemic, being the spark that lights the flame on the next pandemic. Viruses that replicate through RNA have the ability to mutate very quickly. Viruses that spread through respiratory droplets or aerosols have the ability to spread very quickly. So we need to look at that entire category of viruses and find ways to defeat it. You want to have the capacity to scale up the production of vaccines and distribute them. You want to have the capacity to scale up the manufacture of diagnostic tests and have the mechanisms in place to have that handoff to private industry in the setting of a crisis. And finally, the other thing I talk a lot about in the book is getting our foreign intelligence services more engaged in monitoring for these threats overseas. We've often left these kinds of missions to public health authorities like the CDC to engage in multilateral agreements with other nations to try to identify viruses when they first emerge. And we know nations have withheld information from us. China's done it on a number of occasions, including in this case. There was information available, certainly by mid-December, that could have alerted us better to the scope of this threat. We didn't have that information available until mid-January, probably, that this was spreading through asymptomatic transmission, that there was human-to-human spread, that this was a SARS-like coronavirus that was highly contagious. If we had better intelligence gathering, we could have had that information potentially earlier. So I don't think that we can be complacent anymore and just leave this up to multilateral agreements. We're going to have to be more active and get our foreign intelligence services, like the CIA, more engaged in monitoring for public health threats globally.
You make the point about having the CIA monitor things going forward. You make the point in your book that these travel bans we saw, no one can go to Europe, no one can come from China, that disincentivizes a country from saying, hey, world, listen, I want to let you know we got something going on. because they know they're going to be locked out right away. So does that make it even more important that you have to monitor?
It does, and Congress just passed legislation basically creating a biosecurity department within the government that effectively is going to get our foreign intelligence agencies more engaged in this mission. So Congress is heading in this direction. Look, what's the first thing that happened when the British raised their hand and said that they have this more contagious variant B117 circulating? The French closed the channel. You remember the long lines of trucks outside the channel. The United States also cut off travel to the United Kingdom when B117 was spreading there. So if anything, countries now know that if they raise their hand and they divulge it, they're host to a new emerging infection that could potentially be threatening to the rest of the world. They're going to have trade and travel restrictions imposed on them. So it creates even more of a disincentive to go out with that information early. So I think we're going to have to rely even less on the kind of multilateral commitments that we make between nations to share information, and rely more on the ability to just gather that information through clandestine operations. This information, can be had. We can have sources on the ground. We can be talking to local physicians. A lot of the information is passed electronically. So I think we could be learning much more about the global threat situation when it comes to biosecurity.
Governor, you were nodding while Dr. Gottlieb was talking about being prepared for the next one. What's the state doing? I know we saw a video of Hartford Healthcare stockpiling PPE that we talked so much about last March and April and May, trying to gather that. What is the state doing so they're ready in case this happens again?
Well, there was no stockpile down in Washington 2 years ago. Those cupboards were bare. This time around, our new Britain warehouse, we've got the masks, we got the PPE, we've got the relationships with our hospital providers. They work together hand in glove, really key going forward. We know the testing and the vaccination people, but we really need the federal government to be involved. And thankfully, we still have Scott Gottlieb here in the state of Connecticut, so we'll have some pretty good expert advice along the way.
Well, I know that's somebody that you relied on. Dr. Gottlieb, I want to just ask you, as we're running out of time here in our special report, you talked about hopefully this Delta variant being the last big wave, but just for people at home who don't have their finger on the pulse like you do, what are the markers? What should they be watching for? What's the turning point where they can say, aha, Dr. Gottlieb said I should watch for that, and now I should take a deep breath?
Well, I think looking at the prevalence, how many infections per 100,000 people per day, and this is on the website of the New York Times and other websites. Right now in Connecticut, I think it's around 12 to 15. It's pretty low relative to other states. We're doing quite well here in the state. I think looking at that in the near term, that'll give us an indication of where this Delta wave's heading. Longer term, we have to look at, what impact this virus is having. The virus isn't going away. It's going to continue to circulate. What you really want to do is be watching hospitalizations and bad outcomes from the virus. And if you can keep hospitalizations down, you can avoid bad outcomes because you're getting people vaccinated, you're getting people treated. This becomes a livable pathogen. We're going to have to do certain things differently in the wintertime to make our lives safer from respiratory diseases like this, like the flu. But we're going to be able to get on with our lives.
I know so many people are looking forward to that. Governor, I know you said you had one last thought for Dr. Gottlieb.
Well, I'll just tell you, Connecticut did really well after that first start. We did not have any uncontrolled spread here. Our schools were open, our factories were open. We were able to do it safely. And Scott, advice like yours was really invaluable along the way. Stay involved.
Thanks a lot, Governor.
And Dr. Gottlieb, as I said, I read the book. It certainly is full of interesting things that I didn't know going in. We only have about 30 seconds left. What's the message you'd like to leave viewers here in Connecticut, your home state, with out of this book? What's one thing you hope they walk away with?
Look, I think we're going to be better prepared for the next time. I think we've certainly identified what our vulnerabilities were, and that's the first step to putting in place better preparations. I know the state's doing a lot to better prepare for the future and shore up our public health institutions. I think it's going to happen at a federal level. Once we get through this pandemic, hopefully federal leaders will put in place better preparations, and this won't happen again.
All right, well, we appreciate it. Dr. Scott Gottlieb, we've seen you so much on Face the Nation on CBS, and we appreciate you being with us. We're going to mention it one more time here. Dr. Gottlieb's book is called Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. You can find it at your favorite bookstore. Dr. Scott Gottlieb, thank you for being with us this morning. We appreciate it. Governor Lamont, thank you for joining us here in studio. We appreciate that as well. Certainly a lot to talk about. And as you said, Dr. Gottlieb, hopefully we are towards the end of this pandemic and we can start looking ahead to preparations and things like that moving forward. Thank you both. That is our special edition of CT 21 tonight. Thank you for joining us. We invite you to tune in to our Sunday edition of CT 21 each week at 8:30 a.m. Enjoy the rest of the week. We'll see you back here in Studio A next Sunday morning.
Thanks for watching Channel 3 Eyewitness News. Watch us live wherever you are on our mobile, on our streaming news app. And you can also watch us on Roku, Apple TV, and Fire TV.